Hi friends, my name is Joni. I am a pre and postnatal corrective exercise specialist, and today we are going to explore pelvic posture. What is it? How to determine if your pelvic posture is throwing you out of balance, and if so, what is the number one thing that you can do to fix it? So first of all, what is pelvic posture? Simply put, it's the position of your pelvis in relationship to the rest of your body. And there are three types of pelvic posture. The first one is an anterior pelvic tilt, which we're going to dive into today and talk about specifically. That's basically a sway back where you see someone has a big arch in their lower back, their tailbone's kind of flipped up, maybe their belly is spilling out the front. Often the position that you think of when you think of a pregnant person and how their posture has adapted to the pregnancy. Second type of pelvic posture would be a posterior pelvic tuck, which would be the opposite of that anterior tilt, where the tailbone is tucked under and it almost looks like they have a completely flat butt or no butt at all. And then number three would be neutral, which is a happy medium right in the center. There's a little bit of like 4 to 10 degree of an anterior tilt, where it's not too far up, the tailbone's not too far up and not too far under. So an anterior pelvic tilt, which is that pregnancy posture, I'll call it like a pregnancy pride position, chest is kind of puffed up, belly spilling out the front, tailbone is flipped up the back, can lead to some less than ideal symptoms. My philosophy on all of this is if it's not broken, don't fix it. If you are symptomatic, then absolutely let's address it. But for my pregnant people that are going into these postural changes, they don't have pain, they still have proper movement mechanics, the right muscles are firing. We do a little bit to work in and out of, balancing those muscles and keeping them very mobile, but I won't necessarily go into a deep dive of trying to correct the anterior tilt. So keep that in mind. But the symptoms that you would want to look for are what they call these lower cross syndrome symptoms. And this would lead to low back pain because of that crunch in the lower back, weak abdominals because the belly is just splaying out the front, also tight hip flexors, and then also weakened glutes. But again, if you don't have these symptoms, you get good muscle activation in your mechanics, don't fix it. You can balance and keep things mobile, but don't necessarily think of it as a problem. We're often told, especially in the fitness industry, that if you don't create this perfect picture, then you're wrong and you need to do something to fix it. And that's not necessarily true. It's only a problem if it's a problem. So the number one exercise that I promise to share with you to correct this tilt if you are symptomatic is a really easy one. Get ready for it. Walking. The mechanics involved in walking of just transferring the weight from one foot to the other, one leg to the other, the activation of the posterior chain from heel all the way up into your hips and glutes, just mobilizing through the hips, keeping the pelvis really mobile. That's the number one thing that you can be doing if you are experiencing some of these symptoms for the anterior pelvic tilt. In summary, anterior tilt's not necessarily a bad thing. So if it's not broken, don't fix it. And if it is, get yourself out there and walk, get into the platform, do these workouts that I put together for you. And overall, in the long run, total body strengthening, walking, good nutrition, good sleep, some kind of mindfulness practice, those are really the best way for you to be alleviating any symptoms in your body. If you have questions, don't hesitate to reach out. You know where to find me, and I'll see you guys really soon.